Now I am going to explain how to apply urostomy bag. For that, we should clean the skin around the stoma, cleanly. Then it should be dry, because always when we change the urostomy bag, continuously urine will be coming. So make sure that all the things everything kept ready. First we should take a flange according to the stoma size, then fix it to the stoma, secure it properly, fix a bag. It should be done immediately, otherwise all the procedure whatever we have done, it will get spoiled. So close this so that urine will not leak from the bag. Most of the patient, what they do is they will close this tap and walk around. If some patients who is bedridden, they will connect uro bag to this bag, so that all the urine whichever collect into the bag will go to that bag. So morning they can empty that bag and they can disconnect that bag.